Welcome back to This Week in Global Health. TWIGH is a weekly global health news roundup. This week we're talking about antimicrobial resistance. Enjoy.
Hey guys, so in honor of Antibiotic Awareness Week, I'd like to share with you a recent study by the WHO that assesses our current understanding of antibiotic resistance. So while 2 in 3 people believe that antibiotic resistance is a potential threat, 2 in 3 people also believe that it's okay to treat the common cold with antibiotics. And 1 in 3 people believe that it's okay to stop taking antibiotics as soon as you start to feel better.
This reminds me of a little study I read from Johns Hopkins last year, where a couple of patients were interviewed on why they use antibiotics even though they know that they won't help them for their virus infection. And most patients would say that they prefer to take them nonetheless, just to be safe.
Resistance. I've said this before, I'm going to say it again. Microbes have been on this planet a lot longer than human beings. They are very good at responding to a change in the microchemical environment. So as we produce antibiotics, it's very likely that they produce resistant strains much faster than we can keep up. So it's extremely important that we take this seriously.
I'd also like to add that, of course, it's not only causes such as patients not finishing their treatments or the general overprescription of antibiotics that cause resistance now and in the future, but it is also, to a large degree, issues such as the use of large amounts of antibiotics in livestock and fish farming. In fact, 80% of all antibiotics in the US are being used for that purpose.
So let me try to put this further into perspective. Now, factory farming in China is a really big issue, and they consume a lot of antibiotics there. So to compare this with the US, in 2009, US consumed 29 million pounds of antibiotics in the livestock industry. The number for China in 2007 was 97 million pounds of antibiotics consumed in the livestock industry.
I hope you enjoyed this episode. Remember to comment in the comment section below. Also, you can get in touch with us at hello@twigh.org. That's TWIGH for This Week in Global Health. Also, we've got a webpage. We're on LinkedIn, we're on Facebook, we're on Twitter, etc., and so on and so forth. Until next time, don't ever change, don't do drugs, always do your best, and speak to you soon. Take care. Bye.